Thank you, and actually, you always make me cry, okay? Every time we meet, you make me cry, so it's how can you actually say anything after this video and after this introduction? I was asked to tell you about the story of our meeting, of our encounter, and that was exactly on the 10th of October 2017, after a first email that Annette sent me on the 17th of September 2017. And actually I went back to my correspondence today, especially because I couldn't believe that in 1 year, less than 1 year, we could do such a long way and to achieve something that is extremely concrete and tangible for NF and NF patients. And if I say that this is a great honor to be here today, it would be an understatement. It's more than that. I've been infected with that passion, and I really want to work with you for hope that was mentioned in the video. So meeting CTF a little bit less than a year ago has been very inspirational and enlightening. First, because NF is not a disease that many people know about, so it's difficult to probably even get through all the foundations and research programs and to catch attention. There are so many other challenges, so it's probably very hard. But with the energy, the drive that CTF is deploying, you have the best worldwide ambassadors, and because CTF had that passion, that drive, and that focus on research, that we could find very quickly common grounds. Because maybe unlike other trade organizations, EFPIA is not just a lobby organization or advocacy organization. We have a tool, which is the Innovative Medicines Initiative, and that's a public-private partnership research program that helps us to do things and not only talk about them. So when this energetic bomb, Annette and her team, came to EFPIA and could very clearly articulate what the problem is, what CTF had to offer, and what they needed in order to progress research, in order to address not only the problems of people living with NF, but probably with many other conditions. And we combined that with the tool, with this innovative medicine initiative that we had. We found that we have something there and that we can engage a real collaboration. So in 1 year, as I said, we've done much more than I could have ever expected. We were developing many other programs, sometimes for 2-3 years, that never came to fruition. And here, with very little time, because of that drive, energy, and persistence. And thank you, Annette, for that. Thank you for chasing me and sending me emails every other week. We actually could achieve something. Why CTF was so important to us, what was different in that encounter, is probably because we have collaboration with many patients' organizations who help us to keep focus on what is important and what matters to patients. But it was the first time where we were actually confronted with a patients-driven research organizations who was doing research, was funding research, and had tools for research that, when combined with the tools that the industry or the other organizations had, could make a real translational difference, could accelerate and speed up the development. And the first test was probably the fact that an idea that sparkled in October 2017 translated into a project in which CTF is actually leading one of the work packages, and which would enable reshuffling completely the way clinical trials are done. This project is under discussion now, would start very soon, and we keep our fingers crossed. And I think that this is an example where CTF would lead work together with the pharmaceutical companies, together with academia and with patients, that would help NF patients with no doubt, but would also help people with other conditions similar to NF. And the other great test case, I would say, was a foot in the door of CTF into IMI project, this Innovative Medicines project, was Paradigm. And Paradigm is a project on engaging patients in research in a meaningful way, having patients' voice heard, not only patients as subjects of research, but patients as actors of research. And the experience that they can share with us would know that, again, benefit the patients with NF, but also many other patients with rare conditions. So thank you for that. And that is just in 1 year, and that's absolutely fantastic. For those who know European-funded projects, 1 year is like nothing, and here, in that nothing of time, you've achieved really a lot. So again, thank you for that, and you can be applauded because you have dreamed. But this is not just about one person, it is about all the many people who are behind this organization and who actually decided to establish this organization in Europe. And this was so important, I think, for everyone. Because Europe has fantastic science, all the fantastic scientists here today and those in academia working every day. We have fantastic power of collaboration. We have probably much better power of collaboration than anyone else that is today completely underexploited. The Innovative Medicines Initiative, for example, is putting together people who would otherwise never work together. And that radical collaboration is combined with the fantastic science and with the real engine, which is CTF, with the drive, with the energy, with the tools, with the knowledge, is actually a guarantee that the hope would actually translate into more than hope. So I'm extremely proud, and this infection actually materialized in these pins which I have every day with me, and which is also telling me that complex problems such as NF, such as rare diseases, need a team. No one of us can actually resolve them alone. And that's why CTF is important to us, because you can combine the science, the radical collaboration, the tools such as IMI, with your knowledge, with your drive and your passion, and the skill of knowing how to raise funds and how to spend them to keep the research community united around a cause that is very worthwhile. So it's not a surprise that you chose the Museum of Music for the place to launch it, because a team, it's like an orchestra that needs a conductor, and I hope that CTF would be playing that conductor for all of us who would be the orchestra to deliver the hope. Thank you.
Thank you so much.